It was terrifying and it was heartbreaking.
Tonight, an ABC 57 exclusive, conquering the coronavirus.
I was not sure when I called my wife with about 5 minutes warning that I was going on the ventilator that wouldn't be the last conversation.
A top doctor at Spectrum Health Lakeland diagnosed with COVID-19 during the first weeks of the pandemic.
Lowell was in the center of the battle. You know, he was a general in this battle.
A man dedicated to saving others, now hooked up to a ventilator, fighting for his own life.
It's dramatic the way this COVID virus can attack the body.
Tonight, we take you inside his story of survival.
I'm a believer in the value of prayer, and he had a community praying for him.
The treatment that saved his life.
You understand the treatment, you understand why, what's coming next, but also you carry the burden of knowing what can go wrong.
And his vow to save others from what he went through.
We're all in this together. This is a tough virus.
Hello and welcome to an ABC 57 News half-hour special, Conquering the Coronavirus. More than 1.5 million Americans have been touched by the pandemic so far, and more than 90,000 people have lost their lives, including more than 120 patients right here in Michiana. Tonight, a Berrien County doctor dedicated to treating others with the disease catches the virus himself and nearly loses his life. We sat down with Dr. Lowell Hamel and his family for an interview you'll see only here on ABC 57 News.
Lakeland, like most hospitals around the country, was in a full-time effort to prepare for COVID, and I was in the midst of that effort.
Dr. Lowell Hamel is the Chief Operating Officer of the rapidly growing Spectrum Health Lakeland Hospital campus, just off the banks of the placid St. Joe River in St. Joseph, Michigan.
I was doing everything that we were trying to do, teach everybody to do, and I got sick. So Lowell gave me a call one evening and said, "I've got a fever." And obviously the first thing that goes through anybody's head is, oh my, is that coronavirus?
Dr. Lauren Hamel is Lowell's twin brother and the Chief Executive Officer at Spectrum Lakeland. The 64-year-old twins from Berrien Springs have worked together for more than 30 years, and we're trying to prepare the hospital for a pandemic never seen before in our lifetime, when the virus suddenly hit home.
We talked about his symptoms and said, you need to stay home and you need to be tested. Well, as it turned out, he was tested and the first test was negative. Fortunately, he stayed home. And we continued to watch over his symptoms, and a few days later he was getting worse and was tested again. And of course that test was positive. I think I probably caught it rounding on the COVID wards at a time when the only people who had masks were the nurses who went into the room.
And you were not wearing a mask at the time because of the shortage?
That is correct.
It was late March, well before healthcare workers on the front lines of the battle across Michigan and around the country had enough masks and other gear to protect themselves from the rapidly spreading virus.
And in the earliest stages, we had so few masks, that's what we were doing. If somebody called with a sore throat or cough, we put a mask on the patient because we didn't have enough masks for everybody else. That did leave gaps in our ability to protect ourselves against as healthcare providers against COVID. I expected to continue to be there providing care and encouraging the team, and then those plans became immediately interrupted.
This risk of catching something at work that could hurt you or kill you, or that you could bring home and it could hurt your family, we've always been taking that risk.
Lowell Hamel's own daughter, Danelle, is a registered nurse working in the coronavirus intensive care unit at the hospital her father and uncle operate.
How difficult was this for you and your family to watch your healthy father suddenly succumb to the virus that you guys have been dedicated to fighting?
It was definitely one of the hardest things we've ever done, that we've ever had to go through. It was terrifying and it was heartbreaking.
In early April, I think about April 5, I got a fever.
And Dr. Hamel knew instantly he had to get a coronavirus test. But like many patients early on in the infection, it did not confirm their fears, at least not at first.
Tested negative, got a little worse over the next few days, went in with a good explanation of what I might have, which wasn't COVID, but in fact the COVID test was positive.
Describe your symptoms. How did you feel? How did it come on, and how bad did it get?
I had a little sense of chillability for a day, and then the next day I had a low-grade fever, just low enough to qualify. I never had any other symptoms. I had no sore throat, congestion, cough. I had profound fatigue along with that, which is close to universal, and that separated this from kind of the common flu and many other infections. I was admitted to Lakeland, was here for about 3 days, got progressively worse.
Dr. Lowell Hamel was being treated for coronavirus right inside his own hospital, but his condition was rapidly deteriorating. So the difficult decision was made to put him in an ambulance and rush him an hour and a half north to Grand Rapids.
Our team, collaborating with Spectrum in Grand Rapids, thought it might be good to transfer there. There might be some therapy that could be available a day or two earlier. So I was transferred by ambulance to the ICU in Grand Rapids, continued to get worse, and ended up on the ventilator.
How bad did this get?
My sense was that my best odds are about 50-50 on the ventilator of coming off. And given how rapidly I was getting worse without any other health issues, I thought probably my odds were more like about 1 in 10 to come off. So it got pretty bad. I was not sure when I called my wife with about 5 minutes warning that I was going on the ventilator that wouldn't be the last conversation.
It was a dark time for the family and Lakeland Hospital staffers, on the verge of losing their leader just as they were starting to see more and more coronavirus patients. And that last video call was heart-wrenching.
Looking each other in the eyes, we both knew that it could be the last time that we talked. And you want to say something perfect.
But suddenly, right when things looked bleakest, a new treatment helped turn everything around.
I believe if I had not received convalescent serum, that I probably would have died.